So you see the difference? This is the side that she had the surgery on. That's 15 years of limited range of motion. And you had the surgery 15 years ago?
Yes.
Okay, so she has more limitation here, but you have more pain on the left or the right, or both are bad?
Right
More
side.
pain on the right side. Okay, we're gonna work on both at the same time. Okay, so let's face me. So I want you to lift both arm up and let me know how much pain you feel.
Here.
How much? Both of them?
Yes.
How much from 0 to 10? Three? Okay, thumb up and bring it this way. How much pain?
Same.
6? 3? Can we do this?
Same.
Same. Okay, have your arms straight. Okay, that's painful. Don't let me move you. Don't let me move you. Do you feel any pain with that? It's all on the bottom? Okay, don't let, she's very weak actually. Don't let me move you. Very weak. Okay. Right, have your arms straight like this. Like here. Don't let me move you. Oh, yeah, you're really weak. Somehow down. Did you feel more pain with what I'm doing? Yes, no?
Pain here. Pain here.
Where? It's more on the bottom or
Here.
on those areas. Okay, all right. So we'll have you lie on your back and we'll take your range of motion, and if you can write the numbers down. Okay, so let's lie on your back, head here. Mhm. And oh,
The magnet? That does happen very frequently. If you don't wear it in the belt, it will fall. There have been times when I'm going to the restroom at nighttime and I forget that I have that in my underwear. Yeah, it's unfortunately.
Yeah.
Funny.
Yeah,
It's okay.
that's why we have a belt with it. It is a belt with it. Fall down.
Oh boy.
Yeah. And one time I actually had it in my, because it's very strong, I had it in my biceps. And when I was coming out of the car, it's actually stuck in the car. So I was like, oh, wow. I hope nobody's seen me.
When I woke up in the morning,
Mhm.
more painful.
We're gonna work on that. Yeah.
It's like now
Well,
it's
it's
so
very,
sad.
very
It's so
typical
painful.
with arthritis. You have more pain in the morning. So let's lie on your back. Okay. So if you can write this down, right shoulder flexion. I'm gonna take the measurement here, and right shoulder flexion. Stretch your arm up like this. So right shoulder flexion is, I don't know if you can see it here. This is, it's kind of like 160. Right shoulder flexion 160. We're gonna compare the numbers, okay? So we're gonna do right shoulder abduction. And right shoulder abduction, that's very limited here. I don't know if you can see it, but you cannot see it. I will show it to you after I take the measure. This is 140. Abduction is 140. Are you writing, Lindsay?
Yes.
Okay. So we're gonna do right shoulder internal rotation. It's okay, but it's still limited. Internal rotation here is 60. Okay. External rotation is normal. External rotation is like 90, almost 90. So external rotation is normal, everything else is limited, okay? While we're here, we'll have you have your head on the other side. We're gonna do the left side because we're gonna work on both of them actually. So head here, yep. And we're gonna compare between left and right. Okay, scoot down a little bit. So left shoulder flexion. Okay, stretch your elbow. Okay, left shoulder flexion is 148, okay? Flexion 148, that's the left shoulder. Left shoulder abduction, bring it up toward the ear. And that is 160. 160 abduction on the left shoulder. So we'll test the internal rotation. Let's see. Internal rotation is normal, like 90. Okay. External rotation is normal here. Okay, so while you're here, actually we'll work on this shoulder. And after the treatment, so you said it was 3 out of 10 constant pain, or it's just with motion up?
When I work hard, cleaning, something like that, pain with
You feel like
off. Pain level is off.
you're pain more when you're lifting your arm up? When you say 3 out of 10, that is constant pain or at worst? Constant pain?
Constant pain is 3, 4.
So at worst, what aggravate your symptoms? What make it worse?
Okay, 먼저 아프게 하니까.
When I get up in the morning,
When you wake up in the morning?
and housework,
Housework.
yeah, and like,
So lifting it increase your pain. I'm gonna do some lifting. Stand up for me. Yep, stand up. Okay, we're gonna try the lifting. This is like probably 4 pounds. Stand up.
think of this.
You can, yeah, we're gonna work on that. Okay, so I don't get it. Okay, this is stand up. So lift this with your arm, lift it up, and tell me how much pain. 0 to 10. How much? How much pain? Oh, she has trigger finger too, so we can work on that later. Sorry. What about the shoulder pain?
Shoulder pain is now. This.
How much?
This is 2.
2? Okay, let's do the other side. Okay. All right, so let's line your back. In there. Okay. It's cold. If you have a jacket, we can put it on the top.
Oh my, muffler.
You have a blanket? We have a blanket. Oh, wow, that's nice. Okay, so we'll keep you warm. I tend to, I do want it on the shoulder so I don't get some motion on it. So make sure what I'm doing is not painful, okay?
Dr. Jacobs, would you mind standing maybe, there you go. Oh, no, yeah, just so we can see you.
Okay.
Thank you.
Pain? So what I'm doing is more painful? Okay. What about now? It's okay. So I'm actually trying to release her fascia restrictions. Tomorrow probably will work on your trigger finger. Okay.
We're leaving tomorrow.
What time are you guys leaving?
I think it's 12 something.
12? Okay. We'll see. Is it too much or it's okay? Pain or it's okay?
So,
It's okay. And you said you had a neck surgery. This is set up for me.
next
This is-
measure for this,
No, you had a neck surgery. Let's set up. I want you to set up.
next surgery?
Your
Oh.
neck surgery. You told me you had a neck
Yeah.
surgery. Yeah.
Oh, next surgery.
Okay, let's turn it all the way toward me, your head. Let me know if you feel pain. The other way. Remember how far you can look, okay? Extend your neck back. You're very stiff actually in your neck. Down. That is very tight. So did they do fusion in your neck?
Yes.
Yes.
What level?
Long time.
How long it has been going on?
20,
20 years?
25.
25.
25 years you had
No,
neck surgery.
2003 she had.
Okay. So any pain in your neck when you do this motion? Very stiff. Okay, because she has a history of neck surgery, I'm gonna actually work on the neck, because any fascia restriction or any scar tissue here, because the fascia is connected to the entire body, it's gonna limit the range of motion in the shoulder, directly and indirectly. So let's move your neck left and right. Remember how far you can see. So that's very limited. That's very limited. And the other side is limited. Extend your neck backward, go backward, and very stiff and down. And let's do side side bend, left and right. And the other side. Do you feel pain in your neck?
It's not pain, yes.
It's just a stiff,
Yes.
tight. And where do you feel the stiffness? In the back or the front? In the back. Okay, is it okay to work on your neck a little bit?
Yes.
Okay, line your back. That's lotion probably. Okay, so let's scoot toward me a little bit.
Oh,
You okay?
조금 올라가.
everywhere.
조금 올라가죠.
Everywhere is painful today.
So you have a lot going on. I'm sorry about that. Scoot down a little. Scoot down.
I think because of my age.
Well-
anymore.
Well, you had a lot of surgeries.
Yeah.
You had a lot of surgery. So you had the surgery. Did you have numbness and tingling in your hand?
The reason she had the surgery was she had a constant headache, and then took the MRI and she had
How's your headache?
I think it's okay.
headache gone for after surgery headache is gone. But downside is
You had a lot of issue with the neck, and did the shoulder happen afterward?
Yes.
Oh, okay. All right. And I can see the scar here to the surgery. You had a lot of surgery. Let's scoot down a little bit.
From the medical.
Relax. Okay. So I'm actually trying to release the fascia with my hand here in her neck. And I can feel there is a scar tissue and fascia restriction, so I'm gonna go deep actually. Oh, don't worry, don't say out, okay? Just a smile on the camera. Let me know if that's painful, okay? How does that feel? It's okay, alright. So because the superficial fascia layer, it's like a wrap surrounding the entire body. So it's a very thin layer under the skin that's wrapping everything. So when you have tightness in the fascia layer, it's like you're wearing a t-shirt 2 to 3 size too small. So it compresses on everything. So really we cannot separate the neck from the shoulder when we talking about fascia, because it's like a Spider-Man suit. You really, there's no end or beginning. It's a continuous system, you know? So when you start to have like a scar, like surgery or any trauma in certain part of the fascia or the body, that make that part very tight and like this. So it limited the range of motion, and it does not give you enough room for the shoulder to move. That's why I like to work on the neck area, because a lot of the time restriction from fascia restriction or scar tissue, and then make sure it's not painful. Is it painful or it's okay? Sorry. Sorry. We already can see the restriction in her neck. And so at least if we can get more range of motion in her neck, we'll see actually her range. We're gonna measure her range of motion in both shoulders and see how she responds to the treatment. Okay, how does that feel? Good, okay. Make sure you tell me if you feel pain, okay? All right. So I'm gonna do some scar tissue release, very gentle. Make sure it's pain-free, okay? I'm gonna put this here so I don't make you mess up. Sorry. Is that painful? It's okay. So I definitely can feel the scar tissue in this area. You guys, like, did they do, like, what they do, like C5-6 or something like that? Yeah, 2 levels or more?
I think 1.
1 level? Okay, all right. So I can feel the scar tissue in here, okay. And it's right on the surgery here. I'm gonna move this side.
Dr. Jacobs, how much pressure are you using with that tool? It doesn't look
that
like you're
is
using.
Because the location, this is very light pressure.
Can you talk about that when you're?
So when you use like, so rule of thumb, I do really very firm pressure. But when I start to work on something like in the neck area, I'm very gentle because there's a lot of other structure there. So, so if I'm gonna do it here, I'm gonna be more firmer than here because you have a lot of like arteries here and nerve and a lot of sensitive areas. So I'm actually very gentle initially, and then when I get on the muscle like the SCM here and the scalings, I try to go deeper. So it's based on the anatomy, but most likely for the muscle, I'm trying to be firm so I can go deep. Is that too much or it's okay? Is that too much or it's okay? Okay. She's relaxing, that's a good sign. Okay. And I can feel the scar tissue here. So I'm going over the scaling muscles. It's attached this way, like an angle. And I'm working on the other side on the SCM muscle is attached here, and the scalings are attached here. So I'm gonna work on both of them. And that, when you have tightness in those muscles, it's gonna decrease the range of motion for rotation and side bend. Because that's where I notice a lot of restriction, and I can feel the scar tissue from the tool that it's rolling over like a kind of small rocks in this area. Can you feel those? Yeah, okay. Yeah, it's very obvious for a patient to feel it with the tool. And I feel it here, like I feel like I'm going over a rock, not smooth surfaces. And also, I get vibration from the tool that I usually don't get it from the, if there is no scar tissue. So I released some of the scar tissue here, okay? And I actually, because she will not tolerate to go deep, so let's try to go deep again now and see if she can tolerate, so I can do deep release for the fascia and the scar tissue, okay?
So when people are doing the home treatment and can you explain how they should do that sequence then, if it's too sensitive or too inflamed?
In the home treatment, we have the home treatment program, and I go into that in detail. Mm-hmm. And I have a model she was working on herself, and I explain how much pressure and how you do.
But like before you used the A5, but she couldn't tolerate it. So what do they do? Like you went to the next tool.
So yeah, I used well, you can use the A3 or A4 to bring the scar tissue very gently. And in the home treatment, I showed them manually how they can release the fascia if it's too sensitive to use the tool to release the fascia. Because now I'm going deep inside. I don't know if you can see it. It's actually at least the whole black rubber is inside and over that. So I'm actually going deep, like 3/4 inch.
So this would be the tool that, of all the tools, the A5 is the one that they'll probably be the most sensitive to if they have inflammation.
If you have inflammation and if you have tightness. But now she's not really, she's doing fine because I released the superficial fascia layer. So when the superficial fascia layer is tight, it's gonna look like this, very tight. It's not gonna allow the A5 to go deep in. So I release the superficial fascia layer, so this is very loose. So when I use the A5, it can go deep in. But if it's pulling like this, it will prevent it from going in. Does that make sense? The answer is yes.
Yep.
Okay. All right, so I'm gonna go deeper here. How's that? Okay. All right. And when you have tightness in the front here, it's gonna be like pulling the whole neck forward. It will prevent the full range of motion. Sorry. Okay. All right. So while we're here, let me do some work on this shoulder. How does that feel? This is the one she had the shoulder surgery. Why she had shoulder surgery here? Did she have the rotator cuff tear or they just cleaning?
She had the rotator cuff and
Partial or full tear?
fascia.
Partial rotator cuff tear. What else did they do?
She was in a lot of pain, so
She was not.
she was in a
I
lot
was
of pain.
in a lot of pain.
Okay. So you had a tear here, so they worked on a tear. Okay.
But pain never went away,
Oh, okay. So
shoulder surgery, you try to, a little pain, but after surgery.
the pain is the same. Yeah. Well,
Not as severe, but still a lot of pain.
Well, from a patient perspective, you probably don't care about the tear. You care more about the pain. I don't care you fix the tear, but what I care, I don't want to feel the pain. But if you fix the tear and I'm still feeling the pain, you might have something else going on, So we're gonna work on that. Can we get some water for her, please? Relax. Okay, I'm gonna work on her trap. Her traps are very tight here. And she has a scar tissue, so I'm gonna see if she can tolerate the A5 on the trap. Is that too much or it's okay? I want you to drink enough water, okay? So I'm working on the trap, going with the A5. We'll just leave it here. So I'm actually going deep, like an inch deep actually with the A5. That's why one of the common questions, I can release the scar tissue or the fascia with my fingers, my hand. The answer is no, it's impossible because mechanically with my finger, I cannot go as deep as the A5. With some patient, in some areas, we can go deep, even like 2 inches and a half or 3 inches deep. With your finger, you cannot impossibly because it's very thick, and actually your finger can hurt you doing that. So some therapists, they teach some techniques to use the knuckle. I'm like, that's even thicker than this. And it's actually more painful to do that and apply some pressure. And other therapist technique, they teach to use the elbow. I'm like, that's impossible actually to go deep because look at the thickness. Mechanically impossible you go deep with the elbow. And guess what? It's so painful with the elbow. That's a bone, So this rubber, it actually has some give, so it's more comfortable than using the bone on the patient. How does that feel? I'm really going deep. I'm going about like 1.5 inches here. And I feel another scar tissue here, fascial restrictions. How's that feel? Sorry, what about now? So she felt a little bit pain, so I decreased the pressure a little bit. It's still going deep, but not as deep as she's tolerating that depth. Okay. And then when she's doing better, I'm actually going deeper. How's that feel?
Okay.
All right. So I'm gonna do the same thing on the other side. Sorry. Okay. So she's actually more sensitive on the right side in general, and that's the one with the chronic shoulder pain and the surgery. So again, I use the Magna Heel, but not now. I want to see how much we gained from working on the proliferation stage, which is the stage we work, the stage of the scar tissue and the fascia restrictions. And then we're gonna work on the inflammation if she needs. But I want to see how much pain is related to the inflammation that she might have. She definitely has some inflammation, but we don't know how much until we reassess. Okay, sit up for me. We'll have you drink some water.
Oh,
Okay. You can do this. Okay, so let's drink some water. And I want you to, let's drink water.
아빠, 내가 밤에 쏘리
Hmm?
잠을 또 못 자는 게 포지션을 바꿀 때만
What's she saying?
Okay, she wake up all the time.
She woke up from pain.
Yeah, because of pain.
Do you sleep on that shoulder? I recommend you sleep on your back because your shoulder pain.
The shoulder and
Oh.
it's very bother me in the pain. So I
Well, we're gonna go over the sleeping posture with you.
just
Okay. So let's move your neck now. Turn left and right and tell me how that feel. Can you tell the difference?
That's
That's
better.
range of motion
Mhm.
more.
yeah.
That's more. Let's extend back. Did anyone, yeah, of course you had physical therapy, yeah? After the treatment, you had like, what other treatment you had for your neck? Massage,
Massage therapy
physical therapy, massage therapy,
can work for
Chiropractor.
chiropractor, okay. Did anyone work on the front of your neck? Because it's prohibited. Okay, I'm just joking. Okay, so let's move it again, left and right.
steady.
Okay, just move your neck only. Okay, extend your neck. You see the speed of movement? She move a lot faster. Smoother movement, it's not very stiff. Go back, extend. See how far she's going, can extend now. She was not able to do that. Can you tell the difference? And she actually going back and forth, that means she's feeling better. So let's do side bend, left and right. Okay, that's much smoother. Okay, so how your neck feel now?
Yeah, it's okay, so good.
You feel looser?
Yeah.
Okay, let's both arms. I want to see if working on the neck, I worked on the shoulder a little bit, made any difference. So extend, going back. How's that feel?
Yeah.
So we're gonna work on the back, but
Don't move, no.
we wanna see how is your shoulder feel, and let's do thumb up here and bring it up to your ear. How's it feel?
Yeah, better.
Better? Okay.
But still pain.
I did not work on this area.
Is this muscle?
There's muscle everywhere. Yeah. We're gonna work on that. Let's turn around, and I wanna see how far you can go back this way. Bring it to your brow. Okay. All right. So turn around. So your pain now in your shoulder here in this areas. Okay. So let's lie on your back. So now we're gonna focus on the shoulder. I was focusing on the neck, just to make sure no neck restriction that affected her shoulders. And because she had a lot of stiffness, see it. Okay, just put it, put it in your clothes, like, so I don't get lotion in your tank top, like, because we can work in this area. Oh yeah, that's a smart idea. Okay. Now I'm gonna work on the scar tissue. So let me know if that's too much, okay? Oh, wow. So you feel it right here, yeah? I can feel a big knot here, very thick knot, right in here. Too much? Okay. So a little bit of scar tissue in her, triceps and biceps, but most of her scar tissue, that's a big one. Okay. Just want to loosen this up. I'm gonna actually use the A5 after this. Sorry, is that sensitive? We did not use the magnet yet. I'm probably gonna use that. Sorry. Okay. And here sensitive too? Okay. Okay. Let me see if I can do something else to increase the sensitivity. Okay. Is that too much or it's okay? So it's hard to see it from this angle, but I'm doing the exact same thing. Is it too much the same thing? Yes or no? Is it as sensitive as the other side or no?
I think the skin of the,
Hmm?
what is it? What is this?
Well, you have your pec muscles here, you have your triceps and biceps. Is that too much? Yes?
No.
So she had thicker knot in here. There's a knot here. Sorry. Here, that's a very thick scar tissue.
Dr. Jacobs, can you imagine if they were doing stainless steel, like breaking
Tools,
it down
yeah.
on her?
Yeah, that was one of my prototype that I had to throw in the trash. Because it's extremely painful. It's ergonomically not designed. It's just sharp on the body, you know. Yeah, that's why I don't like the stainless steel tool. Because there's a lot of disadvantage of using the stainless steel tool. And you can see a lot of videos for patient have this treatment, a lot of bruising, and you can see some of those videos actually they did not mute the video. You can hear the screaming of the patient. I'm like, are you torturing the patient? Also, you torture the patient to break the knot. And what the benefit of breaking the knot, and it's actually causing another trauma, causing more knots. And putting in the patient in more pain than what they came for, which is really not the best approach. So she's very inflamed here. Let's get the magnet heel from your back and we're gonna put it here. We'll use it.
Is it still in your back?
Okay, still have it. Still have it, okay. So this is a magnet heel tool. I'm just took it off the belt that comes with it. Just for me, I can use it here in the clinic, work quickly, because she has a lot of inflammation in this area. She's not tolerating the tool, so I'm jumping to the inflammation protocol. And part of the inflammation protocol is anti-inflammatory diet. And I go over that in the patient programs. And We start with her with some supplements for inflammation, and based on the nutrition evaluation we did yesterday, there's signs of several deficiency of vitamins and minerals. So we start to work on that to optimize the body normal healing cycle. Because if you have, like, for example, if you have deficiency in magnesium or C or D, you need those for your body to heal, to move from an inflammation stage to proliferation stage to maturation stage, which is the 3 stages of normal healing. So MagnaHeal is going to work very well when you don't have deficiency. When you have magnesium deficiency, this is not going to replace magnesium. We need magnesium, that's example. Or C deficiency, we have to have C. So that's why we have to do the nutrition function evaluation to figure out what is missing in the body that impair healing or prevent healing. So when we use the tools, the body will respond fast. How does that feel?
Okay.
Yeah, so this is very strong magnet. I stuck in my car, as I said before, because of that magnet. I had it in my arm. So it's really strong. How does it feel? So that's where she has a knot. So she has really 2 big knots. Well, at least one in here, and on the other side she has both the same thing. And that's what limited the range of motion of flexion, abduction. And that's actually where she feels most of her pain when she moves her arm, because that muscle. So normal muscle should contract and relax like this, like a rubber band. So when you have a knot, it's like you have a knot in a rubber band, or you have a scar in a rubber band. So when your muscle contracts, it's not going to stretch much. It's going to prevent full range of motion, and that's what we see in this case, and most of the cases with limited range of motion. So no pain in the top here, it's just all in here. Is that correct? And this side too, is that correct? And the top here where you had the surgery? Okay, let's do work on that.
How many of these sessions, Dr. Jacobs, would a home treatment patient need to do for after surgery, like for her case?
It depends on how much inflammation, and it depends on the deficiency. So if your body's stuck in the proliferation stage and you don't have a lot of inflammation, usually few sessions, max 1 to 2 weeks. If you have inflammation, that could take it a little bit longer. That's why we include the option for MagnaHeal 2 to start to wear it as soon as possible to decrease the inflammation. If there's no vitamins and mineral deficiency, it should be a few weeks.
So for a patient like her, how bad would you say her inflammation is?
Well,
Is she
because
severe?
we're dealing with a lot of things, like there's GI issue, there's cholesterol, high blood pressure, there's several vitamins and mineral deficiency and hormone imbalance. So we have to work on all this imbalance simultaneously, because you need a perfect hormone balance, you need a perfect mineral balance, vitamin balance, so the body will do what it's supposed to do. The more deficiency you have, the longer the time it will take to really get the body to the optimal level. But we cannot pick and choose, okay, I'm gonna use the tools only, but I'm not gonna take the vitamins. I'm like, well, you need the C, the D to help you to heal. So each person is a different, but the more complex the condition, the more things we need to fix. It's like you have a plumbing issue, but the plumbing issue is you have 5 holes. You cannot choose 2 holes to fix and expect that the plumbing in your bathroom is totally fixed. You have to really fix all the holes, otherwise it's not a full fixing. So that's how we know how long it's gonna take to recover or to get to the best level of outcome. How does that feel? I know she liked the MagnaHeal yesterday. She wanted to leave with it.
And she did.
She did. We took it from her by the door. No, it's, I personally have it with me in my bag everywhere I go, because that's my first thing when I have any inflammation, any pain, I start wearing the Magna Heel, get the inflammation down under control, and then use the other tools. Okay, sit up. And we'll have you drink a little bit more water, okay? Okay, this getting up is actually looked much better than the first time. She did not make a lot of sounds. Okay, so let's, we're gonna do all the movement now. Let's move your head first, left and right. She's still maintaining the range of motion, extend back. Good, and forward. Okay, and side bend, left and right. Good, she's moving, she's still maintaining the range of motion and fast. Okay, let's move your arm up. How's that?
Yeah. Okay.
Okay.
Good.
Good, thumb up, and bring it up to your ear. How's that? You see, that's actually more range of motion here. She is actually was able to go to her head. It's right in here, you feel it? Okay. So I usually like to do some experiment here to see how bad is the inflammation. I will put this here and do the range of motion and tell me if you still feel it or not. Let's go up. How's that?
Yeah.
Pain or no?
No.
So when we do the range of motion, okay, we need to use 2 Magna Heel,
Referred pain.
one with each side. So this is another way of assessing the inflammation level. So it was painful before using the Magna Heel. I put the Magna Heel and had the patient do the range of motion. If the pain gone, that means the inflammation is moderate to severe, and the patient need to wear the Magna Heel throughout the day or at night. So let's lower this down. Okay, I'm gonna put the Magna Heel on the other side and we'll see how she's doing. So the pain was up and down. In here, okay, so let's do the range of motion, don't hit my face. Go ahead. Up toward your ear. How is that here?
Yeah.
No pain?
No.
Okay, so she needs 2 Magna Heel, one on each side. So that's a sign of going back to the other side. That's funny.
What is this?
Yeah, you have a lot of inflammation. What about now?
Yeah.
This is fine?
Yeah.
What about the other side?
Yeah, a little better.
Yeah. So she definitely need the Magna Heel and alternate between side to side. Remember, this is what, 20 years or how many years?
Right side is about almost 20 years.
20 years, you can relax. Right side, 20 years of like pain, chronic pain and having surgery. And so that's an indication of severe inflammation. Let's take your range of motion. So I will have you lie on your back and Liz, you're gonna complete the numbers. So you're gonna let me know the baseline. We're gonna start with, because you're here, we're gonna start with the left side. Okay, lift your head up, lie down, relax. It's cold or high? No, let me lift it up. Okay, let me lift it up. Just relax. Okay, so what did we have for the left shoulder flexion?
You had, I love how you asked that prior to the, it was 148.
Did you write it?
Well, no, yes, I was just,
usually remember the number if I did one side, but.
just for trust purposes for the people that are watching.
So, yeah, so.
Shouldn't they know, like?
You should write it down then.
I did.
While you're watching.
I did
I'm
write
talking
it.
to the people watching. And here, okay, so flexion, how much it was in the left?
148.
Flexion was 148. Okay. Now we're gonna try the flexion again, okay? Okay, lift up.
It's gonna be less, it's gonna be more than 148.
Okay, now guess what? It was 148, now 176.
You crack me up.
It's almost 78. 178. You have to take the number, so that's actually good. Abduction, how much it was?
160.
Abduction 160, so we're gonna do the abduction. That's on the left side, yeah?
Yes.
And guess what? We get 180 now, so 20 degrees. 180. Okay, internal external rotation?
90.
Oh, that's normal, 90.
You had normal for both.
Okay, so let's flip over to the other side. Head here. Okay, so 180 is a normal range of motion. You okay? It's cold. Sorry. I know you don't like cold. Okay, don't worry, you're gonna warm it up with your body. But when you warm it up, we're gonna change the position to the other side. Okay, how much was the flexion here? On the right
160.
side? It was 160?
Mhm.
Flexion here, okay. Straight your elbow. So flexion was 160. We are here. Okay. 170. You get to 170 here. Okay, so 10 degrees, not too bad. Abduction, how much it was?
140.
Make sure you write all the
Aye.
second number, okay?
Mhm.
140. So that was very limited. Okay, let's do the abduction here. Okay, 140 now is 180.
Oh,
Okay, so 40 degrees. Internal rotation,
60.
60. So normal should be around 90, okay? To put it down, okay? So that was 60, now is, one second. Now it's almost 90. Yeah. What, external rotation?
That was normal.
Okay, so that's still normal. Okay, so for me, we'll have you drink more water. So it's a little bit cold. Okay. So we're gonna retest her movement and see how she's doing now. So she gained like some range of motion, she gained 20 degrees, other range of motion, she gained 40 degrees. That's not too bad for 20 years of chronic shoulder pain with surgery that she had and still have the limited range of motion and the pain. And we know that she has a lot of inflammation because when I put the Magna Heel, she starts to feel better. That's mean that she need to have more exposure to the Magna Heel. So let's do a thumb up and bring it up all the way. You see the speed of movement? How that feel?
It's okay. Good.
Good. Thumb up and bring it up to your ear. And she's actually going to touching her ear before she was not able to do that. Okay, let's do this. We'll have you stand up and we'll turn around and do, try to touch your brow. It's okay. How's that? So this one actually was like by her genes. So it's almost closer together. That's actually a very good sign. And that's the right side that you had the surgery, or the left side? You worked on both.
right side is surgery.
Right.
So the right side after the surgery, she was even limited in the range of motion, and that's 20 years ago that she had the limitation, she had the pain, and she had the surgery, and she had acupuncture, she had massage, you have physical therapy for the, yeah. So we just worked on it for a few minutes now. This is like almost close. We're almost there. Let's see if I'm gonna put, where do you feel the tightness here? Front here or down? Here, okay, relax your arm. I'm gonna do an experiment here. I will leave the Magna Heel now and see how far you can go. Let's go backward, the same position. Can you tell a difference?
Yeah.
She actually went a little bit further. I put the Magna Heel there. That's really evidence of inflammation there. So when we use a Magna Heel and decrease the inflammation quickly, she can gain more range of motion. That's a sign of moderate to severe inflammation. That's a case that she needs to wear the Magna Heel several hours a day or even at night. She gained the range of motion immediately with the Magna Heel too. Okay, awesome. You can turn around. So 20 years. Look at this, and she's still maintaining the range of motion without the Magna Heel, but she will need to wear it because she has a lot of orthotic change, a lot of inflammation internally. And to decrease that 20 years of inflammation, it's gonna take a little bit of time with the Magna Heel. So you had surgery, you had acupuncture, chiropractor, massage, and then you have now hospital, hot spa.
Yeah.
Okay.
In a spa, well, take a,
Hot water,
Heat.
and roasting you. Well done, she was well done in the hot spa. Okay, let's avoid that. So what do you think now about ASTR treatment after, having all those? So what do you think about ASTR treatment?
Yeah, it's amazing.
Yeah, can you tell the difference now? Let's move again, everything, and the side and up, and backward and turn around.
Wow.
She's still maintaining.
That's awesome.
That's good, that's beautiful. Let's turn around, and because you had neck surgery, let's move your neck left and right. And the reason I'm really keep doing the range of motion, because it's just not one time that you get the range of motion, she's maintaining it. So let's go up, back. She's definitely going a lot further. Beautiful, side to side. All right, so how's your neck feel? How's your shoulder feel?
It's soft.
Looser?
Soft.
Soft, okay, awesome, yeah, we soften the skin too. Not really, but it's looser.
Inside.
Well, you still have a little bit of scar tissue, we're gonna work on it a little bit more, but your range of motion is really very good for just one treatment. All right, awesome, thank you so much.